Happy Monday, my YouTube friends and family, and welcome back, or if you're new here, welcome. This is Lindsay, and I am back with more daily work from home job leads for you. Now, I am going to go ahead and apologize if I sound weird or if my voice cracks. I have still got this sickness going on. I did go to the doctor yesterday, and there's really nothing they can do about it. They said that I'm just going to have to ride it out, so I am sorry. But I will do my best because I have 5 different job leads to share with you today that are all in the healthcare field. I feel like it's been a while since I've done a dedicated video for healthcare or like one specific genre. I generally do mixed job leads daily to get a good mix of a little bit of something for everyone. But today's video is geared towards those wanting to be in the healthcare field. And the first job I have to share comes from comments that I've seen. It's been a while now, maybe a month or two ago, right before all the holiday season kicked off. Somebody was looking for jobs specifically for nurses to get out of that direct patient care into the work from home field. So the first one I have is geared towards nurses. And then, of course, the other 4 are geared towards people who want to do more like the billing and follow-up and background, like claims, insurance, that type of thing in the healthcare field. So always feel free, if you're looking for something specific, to leave it in the comments. I can never make any promises, but I do read those and keep that in mind. And of course, if you're trying to get to any of these pages to read reviews on the companies, put those applications in. All additional information you can find in the YouTube description box below this video. Now, first up, we have the company WelbeHealth. They have 150 reviews from past and current employees with an overall employee satisfaction rating of 3.4 out of 5 stars. They are looking for an auditor. They're specifically to work with their PACE program for seniors. Now, this is remote for the United States, and this one is geared towards those nurses that want to get into the work from home field. So WelbeHealth's PACE program helps seniors stay in their home. They provide like that in-home health care. And so they are looking for somebody to really do internal and external audits, making sure that those healthcare services that are being provided are in compliance with state and federal requirements. So you're going to conduct these audits, making sure that the policies and procedures are being followed by those who are going into these homes, providing outcomes or recommendations for the compliance team. So you're just kind of gathering information, making sure all the regulatory performance standards are being met, and you're staying up to date on any changes in the laws, regulations, and guidance for people who are providing in-home health care coverage for these seniors, protecting their privacy and confidentiality. So they are looking for somebody who is a registered RN or a licensed LVN. Somebody who has like a bachelor degree in some kind of healthcare administration. So, of course, this is for those of you that are nurses or whatever trying to get out of that direct patient care to work from home. They do prefer somebody who has experience with PACE programs in the past. Not required, though, as long as you have knowledge of like rules and regulations. Now, pay is anywhere from $90,281 a year up to $108,337 a year. Moving into those jobs that don't require you to be a nurse or anything like that, we have 2 different positions from the company TMF Health Quality Institute. They have 65 reviews from past and current employees with an overall employee satisfaction rating of 3.5 out of 5 stars. The first position they are hiring for is a quality auditor. Now, this is remote anywhere in the United States, so they don't have any state restrictions. But they are looking for somebody to really audit or review their second level appeals of claims, making sure that those appeals are in compliance with contract requirements and perform like user testing in the required systems on them. So you're really auditing or reviewing and examining these case files to identify any errors or inaccuracies or any part of the case file that is not compliant with rules, policies, procedures. So you are going to look for any errors, and of course you're going to share that feedback or trends that you notice with the staff, performing basically data analysis and review to identify any improvement opportunities for the actual appeals process. Maybe the process has a downfall somewhere and it can be better improved. So you're just giving your feedback on that. Now, they only require a high school diploma or GED and somebody who has 3 years of general office experience. Maybe you've got some administrative experience, some data entry experience, something like that. Now, they do also prefer somebody to have 1 year of some kind of dispute or healthcare type experience. And sadly, TMF Health Quality did not list pay for their job in the job description. Actual pay will need to be discussed with them at the time of the interview. If you come to their Glassdoor page and you go to the salary section on the Glassdoor page, there are quite a few jobs that say like healthcare quality improvement specialist or healthcare quality specialist. There's a quality improvement specialist, but all of these jobs range in the $40,000 to $60,000 a year mark. So that kind of gives you maybe an estimate to gauge what pay will be like. Now, TMF Health Quality Institute is also hiring a reconsideration analyst. Again, this is remote anywhere in the United States, and a reconsideration analyst really just performs routine appeals work. So you are that support person for the dispute professionals or the physician reviewers for the disputes. The other position was like checking the documentation of the disputes, and this one is more coordinating the delivery of the files and the resolution documents once they have been reviewed and are complete. So you're going to help build the file or that documentation, that dispute case, all the case files from the evidence that's being submitted from the physicians or doctor's offices. And you are just going to analyze each case, making sure it meets the requirements for a valid consideration or dispute, analyzing and making decisions based on medical or non-medical case types. So you're really inputting a lot of data regarding these disputes case files into the system. Again, this only requires a high school diploma or GED and 1 year of general office experience. Now, they do prefer somebody who's had Medicare experience, but that is not required. Again, this one did not list pay. That will need to be discussed with them at the time of the interview. Staying on trend with like appeals specialist and appeals paperwork specialist, we have Aspirion hiring. Now, they have 118 reviews, but they have a little bit lower employee satisfaction rating. They have a 2.8 out of 5 stars, so they're almost right in the middle. So please, if you're interested in this position, read the reviews, do your own research on the company before giving them any of your personal information. But Aspirion is looking for an appeals specialist for their zero balance appeals. Now, it does say this is $17 to $23 an hour. It is remote work from home. However, lower down, it does say this pays $17 an hour. So it looks like the starting going rate is going to be $17 an hour, and then you can get bonuses or raises, or if you have a lot of experience, maybe they'll pay you a little bit more. But they are looking for somebody to really follow up on claims with those insurance carriers that's either been underpaid by the insurance or not paid at all, completing any follow-up actions as advised. So you might have to reach out to these insurance carriers on like online portals, or you might have to pick up the phone and make an outbound phone call to them and ask them why they didn't pay what was expected to be paid on a claim. So you're really disputing or appealing the insurance decision with the insurance company, trying to get them to overturn it and pay the full rate that's been contracted. So you're researching all of these claims variances in the hospital patient account system. It says they use Epic, Meditech, Athena, different account systems. So you're going to have to really be a multitasker, moving around multiple different software systems, and then drafting basically appeals cases to the insurance company for those denied or underpaid claims. So when you're doing this, you're going to make sure you're reviewing all of the details of the claim that was submitted, including the coding, billing, and insurance information, making sure everything was submitted correctly. So you'll have systems you can run your claims through to see what they should have been paid by the insurance company. And then if it was not paid that way, you're going to fight the insurance company before it. So anything that you can argue with the insurance company, you're building that kind of case for argument. So you're including like the patient's medical records, that they needed this treatment, different things like that. They only require a high school diploma or GED, and they do prefer somebody who has healthcare billing knowledge or experience. You've got to have, knowledge of like at least coding terms, healthcare terminology, somebody who can be a problem solver, troubleshoot different errors, great attention to detail, and a great communicator. Last but not least, we have Sarnova hiring. Sarnova has 121 reviews with an overall rating of 3.2 out of 5 stars. They are looking for a patient research representative. Now, again, this is remote for the United States, And so a patient research representative is going to be responsible for basically researching, gathering, and then, of course, entering into their system and database all necessary information and demographics that's required for payment of their EMS claims, so emergency medical services claims. So you're going to enter that information into the patient's file. So this means you're going to collect like the patient's insurance information. Their demographics is going to be like their name, their date of birth, their address, their insurance company, their insurance ID number, all of that information. You're collecting all of that, researching it, and putting it into the system so that all of that's there. Claims cannot be filed out to insurance companies without all of that information. So you're going to be working with hospitals, insurance providers, attorneys, and the patients themselves. You'll have to search various websites and hospital systems to gather this patient information. You might even have to make an outbound phone call from time to time, like through email or telephone, to gather information that is needed to process those claims. And of course, then you're doing a lot of data entry to enter this into the system. Because this is a healthcare position, with all of these positions I've shared, you're going to have to follow HIPAA rules, regulations, and guidelines. But no degree is needed for this one, just somebody who can multitask, somebody who has a pleasant phone manner, somebody who can always maintain composure when things get stressful. You can have a strong follow through. You might have to start some kind of research, and then you might have to pause that, move on to a separate patient, and go back to it. So of course, someone who can kind of keep up with things, be a multitasker, be a quick learner. And sadly, they did not list pay for this one. That will need to be discussed with them at the time of the interview. If you've made it to the end of this video, I owe you a huge thank you so much for watching and supporting me. You can always feel free to leave in the comments anything that you're looking for. I do read those and keep that in mind. Don't forget, if you enjoyed anything that I shared, let me know by giving this video a thumbs up, like button. Sharing is always caring, so please share with all your friends and family, and I'll be back really soon with more work from Home Job Leads just for you.